Hi, everyone. This is Dr. Tom Garcia. I'm going to be a co-presenter on this webcast entitled Arrhythmia Recognition, the Art of Education. As we usually do, we're going to start off this webcast by examining the objective section. The first objective relates to mechanisms. Since the onset of this series, we've been talking to you about the need to understand the fundamental mechanisms that are occurring in the body, both pathologically and physiologically, in order to truly understand how the vectors are formed and shaped by these processes. We have also seen how the ECG machine translates these vectors into graphical representations that we could use to functionally arrive at our conclusion. Think of it this way. An ECG machine is taking pictures of vectors from different angles, and when we process the images, we're no longer shooting in the dark. We get to see what the thing looks like in a three-dimensional picture. That helps us arrive at a much better conclusion. In this section, we're going to be honing down some of our previous discussions and making some final points. Finally, in the putting together section, we're going to revisit this whole thing all over again by looking at how we can use mechanisms to interpret a difficult unknown. Next, we will be looking at some of the finer details of adult education that you can incorporate into your practice today. We're sure some, if not most of these, will help you improve your skills as an educator. Lastly, we will provide you with some of the tips and techniques that we use to facilitate the learning process in our own students. Let's continue by going on to the next section on mechanisms. We've only been talking about mechanisms when it comes to the need to include them in books. Now we're going to look at them on their own. Primarily, folks concentrate on pattern recognition because recognizing a rhythm is critical. There's no disputing that. However, if there's any discrepancy in the rhythm or morphology, they're lost. And if they've never been exposed to it before. If you've never seen a cow before and all of a sudden you see a black Angus, you think all cows are black, but they're not. There's some heifers that are different colors and, Jersey cows, which are a different color, and longhorns, which are a different color. So if you don't understand the mechanism, how can you understand and master the art of interpretation? Or at least become proficient in it and in your own way? I don't think you could do that unless you really get down to mechanisms. So let's take a look at what some people think about these things. Everybody's a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it is stupid. If anyone knows about being called stupid, it's Al. Al flunked out of school, not because he was too stupid to do it, but because he was too brilliant to do it, and he got completely bored in the classroom. Al needed to have more information given to him. He needed to have better books, and he didn't get them. So he got bored and he actually failed. Thank God that his brilliance actually came through later, and we were able to glean a lot of the information that he was able to conceive. The great divide between students and instructors is that, okay? Instructors seriously want discussions and professional presentations. Students do not want to be taught like they've already mastered the material. A book that has a lot of minutia and a lot of advanced concept is not the book for a beginner. And it's also not the book for you, because you're trying to teach them at an introductory and intermediary level. You don't want to teach them at an advanced level before they're ready for it. So just the same as you can't teach a kid to run before he learns how to walk. And you can't teach him to walk before he learns how to crawl. In choosing a beginner's or intermediate book for your students, take a look at them, and if the book or the author tries to impress you with their knowledge, tries to impress you with how cool they sound, run like the plague. If he can't laugh at himself, it's going to bore the heck out of you. I can be professional as dry as the next guy, but when I teach, I like to be myself. It always cracks me up because academicians hate my books. They hate a lot of times the way I lecture because they don't like that open freestyle. That's okay. When I go to a conference and I teach, I've actually taught in front of 1,000 people, and I've had 999 glowing evaluations, and one person always says, I can't stand him, I hate his guts, I hate his clothes, I hate the way he brushes his teeth. You're never going to please everybody because it reminds them of their old boyfriend or, their father who abused them or, whatever. Something's always going to irritate somebody about you. So don't ever try to please people. Try to please yourself and try to get across the information. If I can get across the information to you by being natural, why shouldn't I do it? Okay, it's the same thing with a book. Students love the book, and if you go to Amazon.com and you read some of the evaluations on any of my books, you're going to see that they start off saying, well, I wasn't used to the style and it started getting me a little crazy, but after I read it for a few minutes, all of a sudden I realized there was a feeling like Dr. Garcia was in the room sitting next to me teaching me. That's the way you want to get across. That's the way you want to be remembered. Okay? It's you sitting down with the person in the room trying to talk them through the information. That's my personal opinion. Scientific papers and scientific journals, that's a different story. So remember, never buy a book that expects you to be an expert before you read it. Don't make them feel like an idiot. That's what I think Al was trying to explain here. And remember that nobody's an idiot until they've been given a chance to be an idiot. Okay? And then they will probably forever be labeled that way. The next thing I want to talk about is Dr. Hawkins. The greatest enemy of knowledge is not ignorance. It's the illusion of knowledge. That's an actually very deep thought, because it's the illusion of knowledge. The fact that you think you know more information than you do is the most dangerous part to knowledge. How many times have you run across somebody who feels like they're the world's greatest expert, when in reality you catch them at a bunch of mistakes, and you realize that they're just very good at faking the fact that they know this information? Well, there's a lot of books just like that out in the market. Be very careful of them. There's a lot of you that have a lot of doubts about the friendly conversational style, in either a book or in a lecture. Dr. Hawkins wrote A Brief History of Time, which is an excellent book. I highly recommend you read it. It brought cosmology to millions of people. Why? Because it was easy to understand and it was easy for us to use. If he would have chosen to write a book that wasn't down to earth, that was full of scientific jargon, okay, and mathematical equations, it would have blown us out of the water. Nobody would have read it. Nobody would have gotten anything out of cosmology. But now everybody understands what a black hole is. Okay, why? Because he used simple analogies. He used concepts that everybody could understand, and he wrote it very simply. He didn't try to impress us with his brilliance. The final result was we were impressed with his brilliance. Okay, sometimes simplicity is brilliance. That's one of the take-home messages that I've found throughout my life. I actually write my books the way I enjoy reading a book. It's something that doesn't make me have to work to glean that little bit of information out of it. You can explain it to me. You don't have to baffle me with your BS. There's a statement that says, if you can't dazzle them with brilliance, baffle them with BS. Well, there's something to be said for that. Mechanisms, as I mentioned before, are critical for interpretation. It's okay to understand the pattern of Wolff-Parkinson-White. Like right here, you have the pattern of Wolff-Parkinson-White. You have a short PR interval, you have a delta wave, you have SDT wave abnormalities, which you can't see because it was cut off the paper, and I apologize for that. But it doesn't go into why that is caused. The reason that you get the short PR interval is not because you have a short PR interval, it's because the conduction is already occurring through the AV node and the accessory pathway, both at the same time. But while you have the physiologic slowing, the part that goes to the accessory pathway didn't get blocked. So since it didn't get blocked, it's going to be transmitting by direct cell-to-cell contact, which is a slow transmission. So what happens is you start getting that slow transmission, which is graphically represented as the delta wave. And then all of a sudden, the transmission goes through the AV node, it goes to the electrical conduction system, and bang, it fires off throughout the rest of the heart, which is why you have the nice, tight, sharp QRS complex. The SD and T wave abnormalities occur because repolarization doesn't occur the same as it does in one that hasn't been depolarized in a simple pattern. It's been depolarized with aberrancy, and that aberrancy gives you the abnormality in the ST and T wave section. So if you understand the pathology, even if you can't remember the specifics, you can figure out what the complex is going to look like on the EKG. Mechanisms are kind of like an X-ray vision, okay? It's like Superman's X-ray vision. Okay, we use the diagnostic tools all the time to be able to see what's inside the chest. We have to look at an X-ray. X-rays will show us masses, just like that mass is over here in the patient's right lung. And ECGs and rhythm strips are just another technique to derive the pathology that's underneath the skin. If you think about it as a graphical representation of the vectors that create the pathology, you'll understand that pathology alters those vectors, and those vectors will present to you in a different way. So once again, being able to use mechanisms allows you to have that X-ray vision into what the underlying pathology is. And that's the way we get to a correct diagnosis in these EKGs. That's kind of a lost art for right now. Let's continue talking about adult education now. We've mentioned a few topics about it, but I want to spend a little bit more time to get this concept clear. When you look at me sitting there in my third grade class, you see Barney in front of me. And Barney, to me, would have been really stupid in third grade, but it's there to represent the fact that childhood education is not the same thing as adult education. Children have to be led. They're used to being taught by almost forcing them to read the material, go through the material, repetition. And once again, they're usually visual learners, which is why visual representations of these things actually do help them out. And they like picture books. The one thing is that they require a different way of teaching. Adults don't require us to force them to learn. If they feel that there's a material that they're going to need to use in their life, they can use it without having us beat it down their skull. So what they are is not big kids, okay? In other words, adult education is not based on child education made for big kids. Yeah, it's not grade school education with a higher vocabulary. It's the principles that guide it are different. Adult education is more visually oriented. 90% of the people are visual learners. 10% are auditory learners. So how we get those visual cues to wake us up and to keep our attention is really important when you teach adults. Okay, you don't want to do boring presentations that once again will make them fall asleep. Okay, would Barney draw your attention? It would draw mine, but just because I hate that purple dinosaur, it tortured me over a bunch of years. But for most people, it doesn't really have that kind of connotation. But other visual cues would attract my attention. So those are pretty good visual cues. They attract most attention, and I think most people would try to wake up to when they get presented with different things like that. So the messages need to stand out very clear in adults. You have a limited time to get your point across to them. You have a limited time to catch their attention. You need to catch it as quickly as possible. Unfortunately, being politically correct causes you to have less of this type of clue, and I know I'm going to be paying that bill for a long time too. So the cool buzzword for the educational community is visual, auditory, and kinesthetic learning. As I mentioned, 90% of us are visual learners, 10% are auditory. Well, where does kinesthetic come in? Kinesthetic is actually physically interacting and manipulating with the objects in order to develop greater physical skills. That's really good for being able to understand how to put people on backboards, how to intubate somebody, how to put in an intravenous line. Now, in this particular case, I want you to get those kinesthetic thoughts out of your mind because you people are sick, okay? This is a serious learning slide. It's not an X-rated movie, okay? I know that you've had, some exposure to this, but this is not... Okay, let me start that over again. Man, I'm going to be spending a lot of time handling PC complaints. But anyway, you get my drift. It wakes you up, doesn't it? Okay, attention span. Here's an interesting fact. How many of you have watched Romper Room or Sesame Street? I know most of you have, okay, because most of you have either seen it in passing or you've raised kids or grandchildren or nephews and nieces, whatever. So you've seen it at some point in your life if you haven't seen it yourself. When you watch it, don't you feel like the writers have ADD? I mean, they're constantly flipping topics every few minutes. I mean, it's crazy. It's just when you started getting something, they change it out. Well, the main reason for that is Romper Room and Sesame Street, basically, the producers are very intelligent. They actually found out what the attention span of pre-K kids is. And the attention span of pre-K kids is 2 minutes. If after 2 minutes, you're still on that topic, those kids are doing something else. Very intelligently, they focus their show every 2 minutes. In other words, they talk about the letter N, and then they do something 2 minutes later that has an N in it, but doesn't have anything to do with what they were talking before. They switch topics every 2 minutes. Kids stay mesmerized for the entire hour. That concept of switching every 2 minutes is great for kids' education. It also makes us happy because it gives us a relative babysitter for an hour, so we can actually breathe for a second or two. But everything has its price. And that's the reason why millennials in today's day and age are constantly messaging and checking their phones or doing something while they're standing with somebody else having a conversation, or, they're on a date and they're sitting there flipping through their phones. Okay, they have to have constant stimulation. They have the attention span of kumquats compared to normal adults. That said, the maximum attention span of most non-millennial adult learners in a classroom is 15 to 20 minutes. Okay, you either have to make your points within that time frame or keep their minds distracted by resetting the clock. And you reset the clock by doing things like humor, graphics. They play unbelievably important roles in resetting that clock. It brings you back to what the main points were. You don't have to switch the point, but you just have to wake them up every once in a while. That's why in teaching, being a non-professional is actually professional. Breaks in the lecture by introducing mental stimulation exercises really helps too. Okay, give them an unknown. Give them something that they're not familiar with. You got to break those things down a little bit. You got to make them think about stuff. You got to give them anecdotal stories. That'll keep them motivated and keep them awake so they actually get the grasp of the material we're trying to present to them. We've been doing this to you from the beginning of the webcast. You haven't just realized that we've done it, or some of you have. But the problem is it works. It keeps you awake during most of it. Okay, poetry versus pattern recognition. Nothing glazes over the eyes and minds of your students more than a slide with a ton of writing on it. These slides that have 1 million bullet points are just a waste. Okay, slides should have the most 2 objects of attention and have a very concise amount of information. The rest should come from your voice and your presentation. Reading without emotion is also super boring. Let me put it to you this way. Reading without emotion is also super boring. Okay? You need to be enthusiastic, energetic to keep their minds stimulated. You need to keep them on point. I love poetry for a lot of reasons. I've taken courses on poetry. I've done a lot of stuff. My favorite part about poetry is that in a matter of a few words, they can use imagery and emotions to elicit a tremendous amount of emotional content from the readers. You have a sonnet, you have 14 lines that you could actually get across a ton of information across. That's a challenge. But by the same token, that's the beauty of it. All of us have that experience in one way or another. Remember the time when you were listening to a song and all of a sudden you're back in your lover's arms, or you're crying over the death of a loved one or whatever? The song is such an important, you just hear a couple of notes and it just takes you right back. It transcends space and time to take you right back. The same thing happens with smells. The sense of smell is so strong that it'll take you back to your mom cooking dinner. Or when you smell somebody's body odor, you go back to, the locker room where you were shoved into a cage or into a locker. Or it'll take you back to walking by a bakery that you used to love as a kid, and then that sense of wonder that you used to have in anticipation before you ate that little pastry or whatever. Those are the little things you're trying to do in your lecture. But the way we do it is by focusing on analogies. Okay? By focusing on analogies, imagery, we can get the same information across about arrhythmias or whatever it is that you're going to be talking about. Think about that. We're going to see some examples of that when we go to the putting all together section a little bit later on. But it is the universal language you can capture upon. Think about human experiences and how you can make things easy for your student to understand. The principles are easy to explain if you explain them in ways that everybody can understand. But if you try to baffle them with a bunch of technical jargon, you're going to lose them very quickly. So I'm going to leave you with that parting thought. Poetry is language at its most distilled and most powerful. That's a really interesting thought. All right. Another thing we need to master is the fact that we need to cover a few topics well. We can't cover every topic. One of the things that's kind of driving me nuts about this particular lecture is I'm trying to cover a lot of information. And a lot of the information gets lost and it becomes overwhelming after time. But that's one of the big complaints that I hear from students all the time, that there never is enough time. Instructors say there's never enough time. Organization is the key to overcoming that shortcoming. Now, when I was in med school, classes in med school were really useless, okay? They were usually taught by super specialized teachers and instructors who basically came in and they had their own little niches in life. Like, I'll give you an example. In my biochemistry classes, there was a professor who was very renowned because he was an expert in lactose dehydrogenase. Well, in biochemistry, we sat down and we listened to a lecture about how lactose dehydrogenase intermixed with every particular topic we dealt with in biochemistry during those 6 months. Do you have any idea how boring that was and how useless that was? Because, yeah, he had some points, but the points could have been summarized into a 10-minute lecture. It didn't have to be narrowed down to a 6-month mental exercise on how lactase dehydrogenase is important for our everyday life. Do you want to be that kind of teacher? No, you want to focus on what is important, okay? So cover the most important topics in your class and not try to get every concept down. Also cover the most confusing topics, because those are the ones that they won't be able to figure out on their own. The rest they should be able to figure out on their own. Students are not helpless individuals. They can't help themselves. They can still put on their pants one leg at a time, and the majority of them can actually comb their hair. So, they can function. They can learn from a book, but that's, once again, it goes back to choosing the right books for them and the right material. Let me give you a personal example. When I teach a section on sinus rhythms, I concentrate almost exclusively on normal sinus rhythm. Why? Because that's where the money is. Okay, bradycardia and tachycardia are just rate changes of the same thing. And actually, understanding the concept that normal sinus rhythm is the key to unlocking and understanding all the other rhythms that come afterwards. Because if you don't understand what normal is, you can't understand what abnormal is. Okay? Remember, there's no place in early education for minutia. You want to give them generalities and you want to give them information that they can use that's very functional. The minutia comes in later when the really cool stuff happens after you understand the basics. Okay, the last point I want to talk about in this section is there's 100 ways to get to the same point. Okay, you don't want all your students to be mini-me's of the instructor. You don't want them to be automatons that only think in the way you do. You want to open their mind and let them go off on their own. If you don't release them, they're never going to actually become true clinicians. Which brings me to the problem of questioning. Asking questions is a critical part of how you impart an unconscious emphasis on any topic. I've done this throughout this webcast. When I want to stress a subject, I ask a rhetorical question about it. You've all experienced that at least sometime in your life, haven't you? There you go. I just reinforced that in your mind when I just gave you a rhetorical question. You probably didn't even realize it, but it does bring a point across. Remember, it's not just what you ask, but it's how you ask that question that's important. How much emphasis do you put on your voice? How much of an emphasis do you put on what that material entails? And that's all based on your energy level and how you ask that question. Always pause after asking a question. It could be rhetorical, but it could be a real question that you have an answer to. Keep them guessing as to which one it is, but it makes them think about it. And the attention is what's going to make the material be retained by them. Redirect once you finish that by asking other questions, follow-up questions. Give them suggestions. Okay, don't just present the material and then blow it away. Keep going back to it. Go back to it in another section. Interact with that by saying, do you remember when we talked about this? Do you remember this? Okay, and when you do that, once again, you're bringing attention. And the more attention you bring to a topic, the more you remember it. Okay, it's like remembering somebody's name. If you just hear the name once and then you go about your daily life, you'll probably forget it in less than, it's short-term memory, so you'll forget it pretty quickly. Okay, but if you reinforce it and you look at the person and you call them by their name, and then later on when you leave, you write them an email saying, look, it was great meeting you, I really appreciated you, and you go through their name, then their name will stick to you. It's the same concept. Okay, when it comes to books, does your text ask questions? Does it answer those questions appropriately? A book that doesn't answer the questions that it asks is useless because it's the process they need to understand, not the answer. In my book, I ask questions of the readers constantly. Editors hate that. Students love that. Okay, they feel that I'm like right in the room with them, as I mentioned before, because that's the way I teach. And it gives them that feeling of being with the lecturer rather than just reading a book. Once again, back to clinical relevance. Clinical relevance, as we talked about before, is learning something that's useful in everyday practice. Why is it important to me? Okay, we've already covered that. We also need to explain why that's important to them. Okay, in other words, here is atrial fibrillation. Okay, why is atrial fibrillation important? Well, if you don't explain to them that atrial fibrillation causes a loss of the atrial kick and it decreases cardiac output slightly, in some cases very effectively, and it will cause hemodynamic instability, they won't understand that. If they don't understand that rapid AFib means that you lose that little loss of atrial kick really magnifies as a loss of hemodynamic stability, it's a lost cause. If you don't explain to them that you can have CNS emboli because of the fluttering area actually is not moving, and by not moving it forms clots. Those clots break off and go to your brain, that's a problem. EAT with block associated with ditch toxicity. Okay, whenever they have the diagnosis of ectopic atrial tachycardia with block, they should think about ditch toxicity. Why is the ditch toxicity important? Because everybody kills somebody with ditch. So ditch toxicity will kill somebody if you don't recognize the signs that it's giving you. That guy's definitely going to die. Because if you don't think about it, they're dead. All those things lead to making atrial fibrillation an important rhythm that they have to learn, and it reinforces their need to learn that material. A question I'm constantly asked is, what do I need to know this? Okay, my typical answer is because we want to torture you. It's really just that simple. We just want to torture the poor beginner. No, seriously. I usually answer that question with a question. Why do you want to be a clinician? What's your patient going to present with? Okay, you never know. Don't you want to know the thing that's going to save their life? Okay, that's unfortunately a bad answer, but that's the answer they need to hear. That there is no answer to that question. Another example is, why do I need to know all this about normal sinus rhythm? Well, once again, if you don't understand the normal state, how can you possibly understand pathology? Okay, in med school, they teach you physiology before they teach you physiology. Why? It's the same reason. You can't understand pathophysiology unless you understand the normal functioning of the body. Okay, the exact same reason. Okay, let's talk about interpretations. What makes it different when you have a one-on-one setting with a student compared to a classroom setting? Focused learning. Focused learning means that you are in a one-to-one situation with your student to the point where you can devote all the time needed to solving his problem. Are you capable of doing focused learning through a book? Yes, you are. You are capable of doing it. And the way you do it is present a strip, and then from that strip, just break down the information to let them understand how you derived the answer. We talked a little bit about it before, but we're going to really give you a few examples right now so that you can see it a little bit clearer. When you focus your training, that's where you start concentrating on making sure that they understand all the concepts that are involved when they look at a strip. Okay, you need to understand the mechanisms involved behind it. You need to understand what the different morphological appearances mean. You need to understand what the intervals mean in association with that. It's got to be a focused approach to interpreting a rhythm strip. If you don't do that, you're never going to get the right answer. You're not going to get anything out of it. There's the difference between interpretation and readings. Language is an interpretation. We're interpreting the language of the heart by looking at the bioelectricity and looking at the vectors that form those things. Let's take a look at what typically happens in a lot of books. You need to have that focused learning. Let's take a look at this math equation. Now, since we're all really good at mathematics, we all know that the answer is 1, as the book states. So does that help you understand how we got from that equation to the answer of 1? No. But when you look at the actual steps that they took to get to the answer 1, it becomes very obvious. I'm only kidding. This is like psychotic, and I couldn't even begin to understand what the heck is in here because it's really advanced calculus. But I'm just trying to make a point. The point is that if you're trying to learn advanced calculus, you have to understand the steps that they arrived at from the equation to the answer. We all hated that about our math books. We all hated that about our chemistry books. They would give you an answer and they wouldn't explain how you got there. So you would just kind of blow it off because what the heck's the use of looking at it? You're not learning anything out of it. It's the same thing with rhythms. When I present to you the strip and I give you this answer, does that really help you? Well, when you look at the next one, in our book, we not only give you the answer down the bottom, but we also tell you what the rate is, what the regularity, what the P-wave associations are, whether there's dropped or non-dropped beats, all that little block at the top. And then we talk about why you have that answer. Where are all the P-waves buried? Where are they all situated? Where do they come from? What's an S-wave? What's a P-wave? That's really a critical part of that description. Okay, so understanding how that answer was arrived at is much more useful to a student. And last but not least, every one of our strips has an EKG lead on it because all the strips have an EKG lead on them. If you don't interpret the strip based on the lead it's taken in, you're not going to get the right answer. Because remember, leads are like picture cameras. They take a picture of the heart from a different angle. And if you're thinking on a different angle, suppose you're thinking it's coming from the right, when in reality it's coming from the front, you're going to get a completely different interpretation. So you need to know what lead you're discussing. That's the key to this. Moving on to multiple examples. This is a very interesting section, and I really can't stress this enough, okay? As a student, it's important for you to see the variations on a theme. If you're learning music, does hearing one piece give you the spectrum of the instrument? No, it doesn't. You want to hear an instrument in a jazz composition. You want to hear it in a classic symphony. You want to hear it in a child's song. You want to hear the whole spectrum of what it presents with. You want to at least be exposed to some possibilities so that you can see where it goes from there. In arrhythmia recognition, seeing one example of atrial flutter doesn't give you a spectrum. You want to see it in a bunch of different variations. Remember the fingerprint concept we talked about before. It's the same thing. So altogether, we have 24 different examples throughout this book, but not just 24 examples. It's 24 examples that are explained how we arrived at the answer. It explained on how everything was obtained so that they could get the gist of it, okay? Once they understand it, they can have a little bit better impression of it. Now we're going to start having a little fun with all this, okay? We've talked about it a lot. Now let's going to put it together. Let's make something that you can actually see what all this hour and a half of me talking gibberish for is used for. Okay, let's move on. Well, another section's come to a close, and we really appreciate your participation in this series. As always, we're going to give you the information to contact us directly, and we'll get back to you with a personalized answer as soon as possible. Thanks a lot.